Crisis on the rise. Opioid-related deaths in 2021 were 6 times higher than those in 1999. That's according to the CDC.
The city of Crosse has seen an increase in opioid-related deaths in the last few years. News 8 Now's Michael Germain is live in the studio with us and has more information on what's being done to help combat this crisis.
Ken and Emily, the increase of deaths from overdoses is causing major concern throughout the state, including a record number of opioid overdoses right here in La Crosse.
This year we are at 38 confirmed overdose deaths.
Gunderson health officials say if the trend continues,
we'll break 50 if you look at the averages for each month. So, that's a lot higher than what we've ever seen, about 20% higher.
According to emergency medicine physician Crosse, almost all of these cases are due to fentanyl overdoses.
We do have one confirmed death that involved tranq as well, but not in isolation. That is with fentanyl with it. That combination is incredibly dangerous. Hopefully that doesn't drive these numbers even higher, but we're definitely concerned about that.
Over the last decade, Gunderson Health System saw a slight decrease in overdose cases, up until the COVID-19 pandemic.
COVID pandemic really had a significant impact on mental health, and it drove a lot of people to substance abuse, I'm afraid.
According to Eberline, over the last 3 years, Gunderson has seen a steady increase in opioid overdoses.
It does vary month to month, so we will get these spikes, and then it will go down a little bit, and then another spike. But the overall trend has been upwards, unfortunately.
Eberline says there are a few reasons why they're seeing the increase in overdose deaths, which includes mental health.
Huge component of mental health illness concurrent with it. The availability of these substances, the overall need for more treatment are things that are driving it.
Chantel Phillips, a residential treatment therapist at Gunderson Health System, says there are many factors that lead to addiction.
Everything is biopsychosocial, right? There's a biological component, a psychological component, and a sociological component.
Phillips also says it all comes down to 2 main components: risk factors and protective factors.
A lot of the people that struggle with addiction also have comorbid mental health conditions, so sometimes it's self-medicating their mental health.
Phillips says during difficult times like the pandemic or dealing with traumatic loss, it's crucial that first responders have Narcan accessible. According to the Wisconsin Department of Health and Services, fentanyl overdose death in Wisconsin grew by 97% from 2019 to 2021. Ken and Emily, back to you.
Alarming numbers, yeah.
Absolutely. Michael Germain, thanks very much.